안녕하세요. 미사 웰치과 임상철 원장입니다. 晚上好，我是韩国웰牙科医院的林상철 원장. Hello, I'm Sang-cheol Lim at Misa Well Dental Clinic. I'm happy to be with you tonight, and also I'm happy to have a Dentium live surgery and follow-up tonight. As always, today's live surgery will be performed by Dr. Chung. The topic for today is simple and clear lateral approach with DASK Simple. You will be able to learn the simple sinus concept and grind out technique. We will briefly do a review before starting the sinus surgery. Okay, let's take a look at today's case. Today's title is already, as I mentioned before, simple and clear lateral approach with DASK Simple. About the patient information as follows. 72 years old male patient. He want to have implant brand new tooth on the posterior maxillary region. Past dental history, he got already 14, 16 endodontic treatment and caries treatment and the temporary bridge crown now. And he got the diabetes as a controlled. This one is intraoral panoramic view before the surgery. Actually, when the patient first visit the dental clinic, as you can see, upper right molar area have a long span bridge. So this failed, and then he want to get the new brand new tooth supported by implant fixture. About this area, as you know, pre-op CT view is like this one. Very thin remnant of bone. Subantral bone is almost 1 millimeter, right? So very thin layer. So how can you achieve this kind of situation successfully? Actually, lateral approach is the answer. Okay. So this one is pre-op intraoral photo, intraoral view of the patient. The panic area, number 15 area, we can see the gingiva and the prepped ready neighbor teeth. Surgery plan is followed. Number 15 area will be installed by Dentium brand new implant system, a bright bone level, and the sinus elevation with the lateral approach. When the sinus elevation, performed during the performing the lateral approach with the DASK Simple kit, the osteon-free collagen as a graft materials will be used. This a schematic diagram is so simple and clear understanding for approaching the sinus area. Between 1 to 3 millimeter remnant of the bone, the subantral bone, in case of under 3 millimeter, lateral approach is first indication, the first option of the treatment. About the 3 to 5 millimeter, the crestal approach is a first option of the treatment. When we have over 5 millimeter, the abandoned bone, actually it is not abandoned, however, compared to the previous two cases, actually 5 millimeter is very easier to get the initial stability of implant fixation. So bicortical fixation is suggested. So today, Dr. Chung will use a brand new bright implant system at bone level. So this is a schematic diagram and the CT view after surgery in the clinical case. As I mentioned before, first, bicortical fixation looks like this one. The remnant of the bone, remaining bone, about 6 millimeter. So using crestal drill, a simple sinus simple kit, and pushing the sinus, the sinus flowers are pushing into the sinus cavity, the remnant of the bone pushing into the sinus cavity. So we can get the little bit extended available bone. So 7 millimeter implant fixtures available about this area. The crestal approach is about the 3 to 6 millimeter, as I mentioned before. So in this case, actually, as you know, 3.3 millimeter, about the 3.3. So in this kind of case, we can try crestal approach. So crestal approach also, we can use many other devices and instrument from DASK Simple kit. So 4.5 diameter, 7 millimeter bone level implant fixtures are installed this area. Last one, the lateral approach case, under 3 millimeter. Under 3 millimeter case, actually, as you know, the lateral approach is the first option, first choice for treatment of posterior of maxilla. So after lateral approach, 5.0, 7 millimeter diameter fixtures are installed like this one. Actually, as you know, depend on the surgeon's skill and surgeon's concept and opinion. About 3 millimeter, in case of 1.5 millimeter, the simultaneous approach, the same time approach will be achieved when you have a lateral approach, today's surgery case. However, some other surgeons don't want to have a simultaneous approach when you have a sinus elevation. It means two-stage approach. It means first bone graft only and wait 4 to 6 months later, and then put it again of the implant fixture. So two-stage approach will be available also. However, nowadays, the faster treatment options are available, and the favor give us a favor. So the simultaneous approach, it means implantation with the sinus elevation. It is more preferable to the patient and the doctors. Today's surgery point is here, two-step grinding out technique. What is two-step grinding out? Actually, first grinding out, primary grinding, and then initial detaching, the separation from the lateral wall, and then grinding again, cause of widening the lateral window to available to approaching the sinus curette, and a little bit more detaching, and trying using the sinus curette and detaching the sinus membrane from the lateral wall and sinus floor, and after that, the bone grafting, implant installation, and so on. Okay, let me introduce about DASK Simple kit. What is different? The previous version. Actually, DASK Simple looks like simple and smaller than previous one. The original DASK kit, the little bit big box, the green color big box. This one is the red color, the aluminum steel colored steel box. Contain the very simple, the minimal, the essential instrument contained. The sinus instrument kit here, the sinus curette here, and crestal drill and bone spreader lateral drill. Interestingly, the crestal drill is so unique. This one is actually built-in stopper type, and the lateral drill also, the head shape is a little bit different. The match head style, and the smaller than the previous one, the previous original version, right? So the size is smaller and the simple, and the essential instrument all together is put into the sinus kit. So it calls sinus DASK Simple. Okay. So what about the lateral drill? Lateral drill, the unique shape. This one is very similar, looks like match, right? So match head style, match head shape, diamond bars. So diamond bar had a size 4 millimeter diameter, so smaller than the previous one original version. Original DASK kit, the letter were the yellow, gold yellow colored, the semi-sphere type, the 6 millimeter head and 8 millimeter head, two different diameter of the head. So smaller one and bigger one, 6 and 8. And then jumping to the DASK, the sinus kit. Sinus kit have a little bit the bigger compared to this one. The actually 6 millimeter, the black match shape had the lateral drill. However, today introduce about the DASK Simple having a smaller diameter, 4 millimeter, very small. So it is very useful to so tight the height case. Okay, so another surgery point will be here, the using collagenized bone. This collagenized bone, as you know, the prevailed nowadays. Actually, this collagenized bone, get the center of the stage of the bone graft market and bone graft situation. The osteon-3 collagen have 8% collagen adding to the osteon-3 particulated bone. So moldable, easy to handle, so very simple to manipulate, especially in case of sinus elevation, sinus grafting, right? Okay. What about the GBL, the system, the membrane pin? Actually, the membrane pin is very versatile, the instrument, versatile devices, the fixing the flap, fixing the membrane, the fixing the some graft materials. This one is very versatile, the instrument and the items. Okay, so let me introduce about the similar case for comprehensive understanding to you, the overcoming performing using DASK Simple. So actually number 16 area using DASK Simple kit. Sorry about that. This 16 is already done using Simple kit. Now let me introduce about number 26 area. Actually, this area is a remnant of the bone under 3 millimeter, very thin layer. The subantral bone is not sufficient case, as you know. So we need some of a difficult kind of treatment options supplied. First, we can try crystal approach using the crystal drill. However, if crystal drill is not available to the fully sinus membrane elevated successful, so we can convert to lateral approach with the same kit drill. Okay, so crystal incision here, and try with the crystal drill of the DASK Simple kit. And however, during the bone grafting from the osteotomy site, actually it is the detected sinus membrane is not intact. So it means smaller perforations can be seen or can be sensed. So Dr. Chung changed to lateral approach immediately. The flap reflection a little bit more, a little bit wider, and using the lateral drill, make a lateral window and separate the sinus membrane and elevate the sinus membrane and put the graft materials into the sinus cavity. In this kind of case, actually osteon-3 collagen is very available, as I mentioned before, and put the graft materials and put implant, and finally 5.07 millimeter implant fixtures were installed, and the flap close and sutures, right? So all these procedures are done by DASK Simple kit. So tonight actually, Dr. Chung shown us, all of us, clear how can we manage this DASK Simple kit when you have a lateral approach, either crystal approach also. Okay, so this one is actually after the post-op panoramic view. As you know, bone graft materials are very well done, as you can see. And this one is CT view, very nice. Even though the small population during the crystal approach, however, these membranes successfully fully covered with the collagen graft materials, ostensibly collagenized bone. So this one is one of the great favor when you have perforated sinus membrane. This kind of collagenized bone is much better than the particulated bone. So anyway, it's just a simple bone grafting and put implant fixtures. That's it. Okay, the restoration here. Final restoration with a zirconia block. And the final restoration and the panoramic view shown us clear, the very successful done by lateral approach using DASK Simple kit. Okay, let's move to today's surgery room. Dr. Chung is ready to have a surgery. Okay. Starting with the Lindemann drill, the flap list. Checking the soft tissue depths and pointing the proper position. Actually, okay, Dr. Chung, considering about the flap design, the incision design. First, as usual, the crystal approach and flap reflection and the exposed lateral wall of the sinus area and the grinding out is more the casual style. However, today Dr. Chung shown us very unique style, the flap incision. The semilunar incision just on the lateral wall of sinus cavity. Okay, the minimize flap reflection and minimize exposure of lateral wall of sinus cavity. And all of this concept came from the minimize surgery concept, minimalism. Okay. So when we have we need to know about the incision line. The actually lower, the semilunar incision should be located lower than the lateral window, right? So lateral window, the lower border of lateral window should be located 3 millimeter above the sinus floor, right? So I think this incision line should be located the 2 millimeter above the sinus floor. Okay, the exposed minimize of minimal size of lateral sinus cavity and grind out first. And actually it is a diamond bar, the head of diamond bar, 4 millimeter. Okay, a very small diamond bar, okay? And after that, when you see the sinus membrane, the grayish sinus membrane that comes through the thin lateral wall, to stop the grinding and the checking, the fluctuation, and using the elephant foot instrument separate the sinus membrane from the lateral window. And after that, checking all this area should be separated from the lateral wall using this kind of small designed sinus curette. This curette have a different angle, acute angle, the dull angle, so cause of accommodate the approaching the sinus cavity, the different the angled, the sinus curette can be used. So the basic principle using this sinus curette, as you know, the always tip of sinus curette should be touch the bone, the floor or lateral wall, and then the touch and push action is very basic. The instrument, the usage, and after that, the pushing this graft material into the sinus cavity. As I mentioned before, these graft materials are ostensibly collagen. This collagenized bone is very simple and useful and easy to handle, like this one. So extremely reduce the grafting time when you have this kind of lateral or the crestal, doesn't matter. The lateral, especially lateral window technique, actually extremely reducing the grafting time. Okay. So the bone grafting procedures are doing well. The ostensibly collagens are inserted into the sinus cavity. I think Dr. Chung, the small, or his assistant cut it off the smaller pieces of the cylinder type of cylinder shape of ostensibly collagen, and make a smaller the pieces. So easy to handle and easy to bone grafting into the sinus cavity. Actually, the lateral window is very small, you know. The head of diameter 4 millimeter it was. So and just a small windows opening, just a small incision was performed. And very simple, the bone grafting was done. Okay. That actually in this case, Dr. Chung doesn't want to have barrier membrane. So anyway, he is starting the drill for installation of fixture. The prep this style, the fixture, prep this style drilling for installation of fixture. This osteotomy is very simple. I always try to undersize drilling cause of smaller bone volume remnant. Undersize drilling is essential, the procedure. Like this, a softer bone and the smaller bone volume case. Put pass pin into the osteotomy site and checking three-dimensional the pass. Yeah. The actually 7 millimeter or 9 millimeter, the both of the lengths of fixtures are available. Already done all the grafting procedure. all the graft materials into the sinus cavity, and now he is doing install the fixture. Oh, actually, yeah, diameter 4.0, length 7 millimeter. The second premolar area, diameter 4.0, is acceptable, right? This 4.0 diameter for premolar area is the reasonable consensus. Got already, right? And length have some controversy. Maybe some of dentists want to have a little bit longer, like 8, 9 millimeter. However, Dr. Chung choose 7 millimeter length of the fixture. By the way, you know, this bright implant system, the lengths have odd number, so 7, 9, 11 millimeter. If you want to have 8 millimeter or 10 millimeter, you can switching to another system like a superline. Also, like this kind of situation, if you want to have superline also available. Okay, and healing abutment connection was done. This healing actually using as a scan abutment. Okay, checking the ISB. ISB score was 79, 79, almost 80. 79 is very higher score. It means initial stability was so good. And suture, skip the membrane, barrier membrane, the cover top of the cover lateral window side. Why? Why Dr. Chung skipped the membrane covering the window opening area? First, the window size is so small, right? And second, actually, the graft materials was collagenized bone. Collagenized bone have the collagen also. This collagen binder a little bit the working as the barrier effect. Not fully barrier effect like a barrier membrane. However, this collagen, the binder also working as the barrier effect. So Dr. Chung is he is using the pin to fix the flap. Actually, just only one shot, one pin fix the flap of the original proper position, and very simple, and the very perfect the situation, and that's it. Okay. Actually, until now, the running time is 12 minutes. From the incision and until now, actually just only 12 minutes was done. The very short surgery time is needed. So, wow, the incredible, unbelievable. Actually, the very simple, even though the lateral window. So, actually, Dr. Chung have very successful perform of this lateral window technique with the bone grafting and the implantation simultaneously. Even though the small, just only 1 millimeter, the subantral bone volume, the extremely case. Okay, good. We will have 10 minutes later. We will have a Q&A session after 10 minutes. Thank you for watching. Stay tuned. Okay, thank you for waiting. Let's take a look at post-op panoramic view. Actually, as you know, number 15 area, very well done implantation with the lateral approach, sinus elevation. As you can see, this implant fixture was 7 millimeter. If you want to have, maybe you can do the 9 millimeter. However, Dr. Chung chose 7 millimeter diameter and also, 7 millimeter length and diameter 4.0. Okay. Okay. So I think these graft materials very even and well spreading into the sinus cavity. And I think 4 months waiting for the next step, you can do the impression, digital impression with the intraoral scan, and or you can use bite scan. There are many different ways to take impression taking method, and then you can go prosthetic procedure. So minimum 4 months. Maybe if waiting more, I think this bone quality is better and better. Maturate very well, good and good, better and better. Okay, so minimum 4 months. Keep in mind, this one is time limitation for the minimum time for waiting. Okay, let's move to the today's question. Maybe this one is actually, sorry about that. Before starting the Q&A session, we can see the post-op CT view. As you know, the bone graft materials very well spread into the sinus cavities. All the sinus membranes elevate, separate and elevate very well, and bone graft material, ostensibly collagen, put it into the sinus cavity, well spread and well packed. And implant also, the angulation and position was good. I think all the procedures are very successful, even though just a small learning time, the very short learning time, just 12 minutes time is necessary and needed to have a full procedure, whole procedure. This one is healing 1 month, actually. And another comment, I want to have a little bit something more, the comment about this situation. If you want to have a little bit the enlargement of buccal, the contour, even though the soft tissues doesn't matter or bone tissues doesn't matter. If you want to have a little bit the enlarging the buccal contour, so when you have have an incision line, a little bit a different design should be performed compared to Dr. Chung's style. Today's Dr. Chung, can you remember? Just a small semilunar incision into the mucosa, just behind the mucogingival junction, and the small semilunar incision, and then the flap-less implantation. Very simple and minimized. However, if you want to have a little bit buccal contour augmentation, the GBR procedure or the soft tissue augmentation, doesn't matter. The flap design should be the conventional style, the crestal incision and the clavicular incision, and minimum one vertical should be a necessary part, and then flap flexion a little bit more wider, and the GBL procedures are simultaneously with the collagen membrane covered whole this the implantation and bone grafting area should be covered whole this area by collagen membrane. And adding this sort of procedure, you can get a little bit wider buccal contour situation after healing. Okay. The question is a very good question. First one, is it possible to use both crystal approach and lateral approach with DASK Simple product? Yeah, of course, yes. DASK Simple have the crystal drill for crystal approach. This crystal drill so unique design, the built-in stopper type. So millimeter level, the tuning, the millimeter level, a little bit more and more, and shorter, you can, the tuning, the length of drill cause of the built-in type stopper. And this crystal drill, when you use this crystal drill during the crystal approach, the remnant of the bone, the subenteral area, remnant of the bone, the squeezing into the sinus cavities cause of this drill action. So the condensing and intruding the remnant of bone into the sinus cavity, it means a little bit the higher the bone, available bone length. So you can use this DASK Simple for crystal approach also. And the lateral approach, yeah, did you see the today's case? Yeah, perfect, the kit for lateral approach also. Number two, what are the advantages of osteointric collagen, and for what indication do you usually use it? Generally speaking, osteointric collagen, the very versatile and available useful bone graft materials. They actually collagenized bone have a unique and versatile materials, as I mentioned before. So first, actually, as you know, sinus case, sinus elevation case, the crystal and the lateral approach, that both of cases also this osteointric collagen will be applied as a graft material, right? First. And number two, as the graft materials, working as a graft materials when you have a GBR procedure. Basically, GBR procedure, as you know, the autogenous bone and allograft and xenograft and the alloplastic materials, the wide spectrums are available for GBR procedure. However, bone forming ability is higher, autogenous and allograft, and the geno and the alloplastic is lower, as you know. So sandwich or layer technique is available for better performance when you have a GBR procedure, like a little bit deep depression or some socket area. The inner side, the autogenous or allograft, and outer side, the xenograft or the alloplastic graft material. So sandwich technique is better to get the better performance after GBR procedure, as you know. So osteointric collagens working as an outer portion when we have a GBR procedure, right? Inner portion, the autogenous or the allograft, right? And the outer portion, you can put the osteointric collagen as the volume maker, volume maintenance, volume maintaining the abilities, graft materials. This one is better abilities than any other graft material. So inner and outer portion and sandwich technique coupled with a strong, long-lasting Dentium collagen membrane applied, and you can get the better the GBR outcome, right? And okay, yeah, it is very important and main usage for osteointric collagen, right? Okay, one more question added just before from China. Thank you for Chinese doctor. Many Chinese doctors audience watching this video and this program every month. And thanks again. I deeply appreciate that, especially a Chinese doctor. 谢谢大家. Question is here. Why did he fix the flap using a membrane pin? Did you see the membrane pin fixing the flap after surgery? Actually, first, this membrane pin, using the membrane pin, is time-saving and easy to the proper positioning, the flap positioning, right? Cause of just only one shot, and that's it. And hold this, the mucosa and the soft tissue flap, the fixing strongly, very firm, the fixation, the original proper position. Number two, actually, the insert of today's case, actually, did you remember the incision line? The semilunar incisions performed on the mucosa, right? The mucogingival junction, just behind, just upper the mucogingival junction. So it means to the movable tissues, very difficult to have suture, even though the interrupted suture. So in this kind of case, you can use the pin instead of suture technique. It's very useful. Okay, that is why, that is the reason. This is what I have understanding the Dr. Chung's the procedure and performance today. Okay, thank you very much for watching our program today. Next, live surgery and the follow-up will be prepared this month, actually August 18, the Friday, the same time. Okay. Next surgeon will be Seung Lee, a very famous in Korea, very famous doctor in the implantology field in Korea. Okay. Thank you for watching today. 谢谢大家. Bye.